You may never have to worry about high blood pressure again after watching this video. The most important thing to understand about blood pressure is that it is a symptom, not a root cause. Today we will delve into the root causes of hypertension. To begin with, 95% of high blood pressure cases are classified as essential, meaning that the exact causes are unknown. Factors like genetics and lifestyle may play a role, but there's no definitive answer. For some, losing weight, reducing salt intake, exercising, and quitting smoking or drinking might lower their blood pressure. Yet, interestingly, many people who don't exercise or consume high amounts of salt still maintain normal blood pressure levels. It's crucial to note that for 20% of those prescribed hypertensive medication, it simply doesn't work. Why? Because they're treating the symptom rather than addressing the underlying cause. When you only treat symptoms without fixing the root issue, the problem persists. Now, if you have high blood pressure, I'm not suggesting you stop your medication without consulting your doctor. Instead, I want to provide you with vital information to help address the root of this issue. Root causes of high blood pressure. Let's explore some key root causes, starting with vitamin D deficiency. There's a hormone system known as the water pressure control system that, when triggered, causes your arteries to constrict, leading to increased pressure. This system can be activated by low vitamin D levels. Additionally, low vitamin D also causes the body to retain sodium. When sodium increases, water retention follows, which means higher blood pressure. This is why there's a push for individuals with high blood pressure to adopt a low-sodium diet. However, it might be more beneficial to focus on increasing vitamin D and potassium levels. The more potassium you have, the better you can manage sodium levels, as potassium helps protect against sodium's negative effects. Unfortunately, most people are potassium deficient and fail to consume the recommended 4,700 milligrams daily. Moreover, vitamin D deficiency is alarmingly common, especially during winter when sunlight exposure is limited, making vitamin D synthesis in the skin difficult. It's also important to note that individuals with darker skin are at a higher risk for high blood pressure. The melanin in darker skin acts as a natural sunscreen, limiting UV radiation absorption and, subsequently, vitamin D production. This means that those with darker skin may require more sunlight or vitamin D supplements to maintain healthy levels. Next, let's consider the genetic aspect. Some individuals may have a genetic predisposition affecting their vitamin D absorption, potentially contributing to high blood pressure. This leads to an intriguing question. Do we have a genetic blood pressure problem, or is it more about vitamin D absorption? Another significant factor is insulin resistance. Consuming excessive carbohydrates can lead to insulin resistance, which is linked to high blood pressure, high cholesterol, and even fatty liver disease. Low vitamin D levels can exacerbate this condition, highlighting the connection between obesity, insulin resistance, and hypertension. Vitamin D, magnesium, and calcium connection. Vitamin D works hand in hand with magnesium, which is essential for its effectiveness. Together, these nutrients play a critical role in regulating calcium levels in the body. Excess calcium can cause arteries to stiffen, contributing to increased blood pressure. For those experiencing leg cramps, this could be a sign of magnesium deficiency, which allows calcium to accumulate in soft tissues. Women, especially postmenopausal individuals taking calcium supplements, are at risk because excessive calcium intake can lead to heart problems. Magnesium helps manage calcium levels and prevent complications like clotting or arrhythmias. Interestingly, many blood pressure medications such as calcium channel blockers mimic the effects of magnesium, which acts as a natural calcium channel blocker. Similarly, beta blockers, which help reduce adrenaline levels in the body, can be supplemented with vitamin D, offering a natural way to help manage blood pressure. Recommendations for managing high blood pressure. Now let's discuss some actionable steps if you're dealing with high blood pressure. First, consider supplementing with vitamin D. A daily intake of 10,000 to 20,000 IU can be beneficial, especially if you have high blood pressure. Don't worry about toxicity. Spending just 40 minutes in the sun can produce around 20,000 IU of vitamin D. Next, magnesium is essential. I recommend magnesium glycinate or obtaining magnesium from food sources like pumpkin seeds, leafy greens, and dark chocolate. Just avoid high sugar options. Adopting a low-carb diet is also crucial, as high carbohydrate intake can lead to metabolic syndrome, which underlies many health issues, including high blood pressure. Lastly, ensure you're getting enough potassium, either through electrolyte powders or natural sources like greens. By focusing on these nutrients and understanding the underlying causes of high blood pressure, you can take significant steps toward better health and potentially lower your blood pressure for good.